Can we detect schizophrenia in its prodromal phase? Imagine catching a storm before it fully forms. That's what scientists are trying to do with schizophrenia. They want to spot the early signs before the full-blown symptoms appear. The early stage of schizophrenia is called the prodromal phase. It can last from a few weeks to several years. During this time, people might feel anxious, withdrawn, or have trouble concentrating. They might also experience mood changes or odd thoughts that aren't yet full-blown hallucinations or delusions. These signs are often subtle and can be mistaken for normal teenage behavior or stress. Detecting schizophrenia early is tricky because these symptoms are not specific to the disorder. Many people might have some of these signs without developing schizophrenia. But researchers have developed special tools and criteria to help identify those at high risk. For example, they look for mild versions of hallucinations or delusions, called attenuated positive psychotic symptoms. These are less intense but happen more often or get worse over time. Sometimes, people have brief episodes of psychosis that go away on their own. Another way to assess risk is by looking at family history. If someone has a close relative with schizophrenia or another psychotic disorder, combined with a noticeable decline in daily functioning, they might be at higher risk. To evaluate these signs, clinicians use structured interviews and scales like the structured interview for prodromal syndromes and the comprehensive assessment of at-risk mental states. These tools measure symptoms across different areas, including positive symptoms like hallucinations, negative symptoms such as lack of motivation, and disorganized thinking. Early detection can make a big difference. It allows for close monitoring and early intervention, which might prevent or delay the full onset of psychosis. Treatments can include therapy, support groups, and sometimes medication. The goal is to help individuals manage symptoms and improve their quality of life before the disorder fully develops. While it's not always possible to predict who will develop schizophrenia, advances in assessment methods are making early detection more feasible. Recognizing these early signs can lead to better outcomes and help people get the support they need right when they need it most.